Good morning, welcome back. Thank you for staying with us. The hashtag on X is Citizen Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abdikadir. This morning we are focusing on the country's healthcare system given the shift in the healthcare programs the government has initiated under the universal healthcare coverage. And with me in studio is Dr. James Nyekal, the lawmaker representing Seme constituency, who as well is the lawmaker Seme and also a member of the National Assembly's Health Committee, and the chairperson of that committee will be with us here shortly as we take stock of the progress so far of what this then portends for the taxpayers and the Kenyan public, the move into universal healthcare coverage. Thank you, Dr. Nyekal, for finding time for the broadcast. Let's first begin, before we get into the details of the statement yesterday issued by the Kenya Medical Practitioners and Dentists Union regarding the death of Dr. Desiree Moraa, who was attached at the Gatundu Level 5 hospital in Kiambu County. The union says that they are encouraging senior doctors to better communicate with interns. She reportedly decried frustrations and challenges and work environment that she said was not in any way contributed to her progress as a professional, complaining about poor treatment by a supervisor at the Level 5 hospital. Is this what intern doctors undergo, Dr.? Is this what you experience? Is this first-hand account, rather, that rarely comes to the public limelight?
Nothing we are told about. We are not told much about the working conditions, but for the 36-hour shift, I'm actually not surprised. Doctors work extremely long hours, and this 36-hour shift come because if you are on call, for example, you do your day duty. If you start from, say, 8 to 6 or 8, you can't even say 8 to 5. Yeah. Because if there is some work going on, you can't leave it. If you are in theater, you can't leave, but you're supposed to be from 8 to 5. Then from 5, you are actually on call. So if you are on call, then you actually proceed the whole night on call. And the following day, before you leave, you have to do a round and make a presentation on all the cases you show during the night. So many times that round the following day will take you sometimes even up to midday, 2 o'clock. Yeah. And that is when you go to sleep. And then because you are on call at 5, you are back again to work. So that is, and these are the things we have been saying. And this, you know, we were talking about allowances for doctors. And there's something called extraneous allowance. This is what extraneous allowance is. And I remember when that thing, we negotiated that in the year 2000, very many people didn't support it. But eventually we pushed it through. I'm unhappy that some of these allowances have been drawn. Because the argument was, if this person is going to work for 6 hours, then pay them overtime. And up to now, no institution agrees to pay overtime. So that is what we called extraneous allowance. Then we even put things like risk allowance, because you are there, you are exposed, you are exposed to communicable diseases. Remember the young man from Kisii who died during COVID. So you are exposed to diseases. So that is what we were calling risk allowance, even the risk to your life. So people do not understand this. And sometimes, as we said, maybe I'll call upon our senior colleagues. I'll actually take this opportunity to call upon our senior colleagues who are supervising doctors that we really must take care of the young doctors amongst us. If you're a medical superintendent or you're in charge of hospital, really one should understand how long a doctor has to work. Even the consultants that are supervising them. I'll again call upon our colleagues. I've been through both. But the problem, the underlying problem, is the shortage of doctors. And I don't like it, because in this country, there are doctors who are at home because they are not employed, there are no jobs. And there are doctors who are doing 36 hours.
But Daktari, is the system designed to be that way?
It is not designed to be that way.
Then why?
It's a system that is being badly managed.
Yeah, that is then, if we are to take the case of Dr. Destry Mora, it then means she worked for 1.5 days. You just told me off the microphone that when you were an intern, there's a day you worked from a Friday to Sunday evening.
Let me repeat on air.
Yeah.
When I was an intern in Kisumu, which was then the Nyanza Provincial Hospital, now Jaramogi Hospital.
Yeah.
I remember working from actually Friday morning and going, I was working in Department of Obstetrics, and going through up to Sunday evening. In fact, when I went home, I actually went into a bathtub and fell asleep in the bathtub until the next phone rang. So doctors work extremely long hours, and me, I keep saying that it is time. The first thing is employ enough doctors for the work that is available in hospital.
Thank you.
And then even there was another thing was saying that in a room, in a house, they were sharing with a colleague. So this doctor was not even properly housed.
Okay, okay.
So we don't know. I think there was some other information before that even she has not been paid for some time. She was supposed to even have been transferred. We won't even know what circumstances led. So the young doctors work extremely long, strenuous hours.
Okay.
So when the doctors go on strike, when their union leader, Dave Atela, is talking, people should listen.
Okay. Allow me then to take the account of Dr. Kahura Mondia here, the Deputy National Chairperson, the Kenya Medical Practitioners and Dentists Union. Good morning, Dr.
Good morning, Mr. Ayub.
Lovely having you here on the broadcast.
Thank you. Welcome.
Dr. Destry may be just a microcosm of deep-lying challenges that medical professionals experience, many silent probably, but a case coming to the public. Is this one of the major issues that drove you to the streets when you demanded for better welfare for medical interns?
Yes, actually, that's a very good question. Reason being, because of what we saw many years in the year 2010, the union was formed to advocate for the protection of this person's interest, because the sector was not well designed, and the things that led us to go to the strike, that was among them, that the young doctors had stayed for over 2 years at most without getting a chance to get a license to go and practice. So when we agitated for that, we eventually had the doctors start out the internship at the beginning of August. So all these issues arose because the SRC went back against its approvals of what you had already settled on in the year 2017, which is a collective bargaining agreement on the terms of conditions of the workplaces, the staffing issues, the numbers, the salary rates, and all that, and even how soon the money should be paid. Ideally, a doctor should be paid, not even just a doctor, any Kenyan should be paid at the end of the period of 30 days. So these doctors are yet to be paid. The facilities that they are working at, some of them are so short-staffed that the junior doctors end up carrying the whole load and everyone not supporting the junior doctor. It's a system that's not able to absorb and protect the young ones. And that is why we have the Presidential Task Force that is supposed to resolve some of these issues. But even before then, there are enough doctors in the country to plug in some of these shortages. They are yet to be taken in by the system to go and cover for these shortages. We keep hearing there is no budget, the wage bill is too high. And the few that are already working, that they should continue being, like, let's say, exploited or probably overconsumed by the system. Such at the point that the doctor has, not just this particular doctor, condolences to Dr. Mora, but the others as well, that they have to overwork to cover for the deficits. That should not happen. It's not proper.
Okay, Doctor, well taken. We'll be talking about the pledge by the government to employ 100 healthcare workers in the first 1 year. And there's always the question of financing, putting your money where your mouth is. We'll talk largely about that and the 4 pieces of legislations, now acts of parliament, that will enable the new healthcare system designed by the government as the next step to enable the country attain the universal healthcare status. But to just tell us then, Dr. Mundia, for the case of Dr. Mura and her colleagues who are medical interns, or those who are at the moment serving their internship period, what's the amount that they're normally paid at the time?
Well, the amount that the interns are paid varies. Because you have...
Let's say, for example, let's focus on one speciality. For example, let's speak out on nutrition.
Well, nutrition is a different category, different cadre, different expectations.
Okay.
So I will not speak much about them because it's not my call line. But I know they are supposed to be paid something maybe between maybe 20,000 to either 50,000 for the work, depending on the output of the workload that they have.
Give us an example then, hypothetically, we can go with.
Well, I would not be able to give that because I've not seen their pay slips, I've not seen their CBAs, and I don't know what they have arrangements as per the employer. But speaking for the doctors, the rates for not just the interns, any civil servant, their rates are varied as per the cities they are working in. The housing allowance goes in incremental depending on where you are at. So persons in Nairobi, Mombasa, Kisumu probably will earn a little bit higher than the persons at, let's say, Turkana or at Wajir. So, but the range of pay is between about 170,000. This is net after taxation, about 170,000 to about 196,000. So the rest of the amounts, most of it is, actually it's about 130,000 net to about 146,000 net, the range. Because the other part of the salary goes back to taxes as payee, as well as the housing levy and all these deductions that are coming. So between 130 to 140, that should be the range of the pay of the young doctor.
And when you led the demonstrations to compel the government to honor the collective bargaining agreement to look into the welfare of medical professionals, does this pay come on time? Because if in the case of Dr. Mora, the point is, as Dr. Nyikal mentioned here, housing was a questionable aspect. Then there was the environment where she was working. That's the mental status. Does this payment for the interns come on time? Are they paid on time? Are they remunerated on time?
Well, the sad bit to say, I don't know what happens in the civil service, but by the time you're deployed and the time your pay comes, we've always been told there's data processing happening, they're cleaning the data, they're checking, validating, all that. So it takes some time before your first paycheck comes in. So between when you get posted and when you settle and start working, you probably will even get your salaries 3 to 6 months later. During my time, we had to wait for 6 months. That's about 10 years ago. And even persons who had been there before me, they still had to wait. The last batch that has been paid promptly, and I think that's about 2 years ago, that's the last batch of the interns. But the rest of the interns, even the current lot, they're yet to be paid. So they're working without pay. They have to take loans. They have to go to all these exploitative mobile loans. And it's really stressful. Now, about the workplace, there is an issue of staffing again. You need to have enough persons for the amount of projected workload. Because each place has a defined workload. And the amount of work that you're supposed to do safely for yourself and safely for your patients. So imagine Dr. Mora probably was in theater, probably alone, and overworked for those many hours. So she'll probably do have a complication based on the fatigue that she's experiencing, because the system is not able to shield and care for the caregiver. That should not happen.
Thank you. Dr. Nyikal, then, how can we progress? Because we'll be discussing shortly, and in the next 1 hour, the leap we are taking into this entirely different sphere, given that we are talking about now the healthcare scheme that the government is introducing 1st of October, is just some few days from today. When you have a medical workforce already which is stretched, underpaid, and then you're trusting them with the lives of the people. For example, the case of Dr. Mora and the others who are working in hospitals where they are taking care of people's lives, but no one is taking care of their welfare. I mean, it doesn't work out that easy, is it?
Okay, we are talking of what we are going to launch, the new. What we are really launching is the new law, the 4 laws that have come, and the pooling by that law. So, you know, health services, if you look at the health systems, there are critical elements. There is human resource. There is the infrastructure, the equipment that you use. There is also the supplies that you need, and there is the financing. Now, what we seem to be so focused about in this country now, and I've said this so many times, we say it in our committee, we talk to this, but the focus to a large extent is on the finance system. What the finance system we are going to have now, whether we move from NHIF and go to SHA, is to get money to pay for the services that have been rendered. So even if you have that money and you do not have the services that are working, and what are those services? You start with human resource. So if you have hospitals that do have no staff or few staff that cannot work, if you have hospitals that have no supplies, so that, say, from cancer they're not getting their drugs properly, if you have hospitals that do not have good equipment, even if you have a pool, a good large pool of money that is somewhere, it will not work. And so, and if you look at what we are going to launch now, we are actually going to launch the system of payment. It doesn't talk much about the system of services, because if you look at it,
that is
the large,
October?
First of October, yeah. The large part of the systems of service is actually with the county government. If you take from level 2 to level 5, that is what provides the largest component of the public service. And then the private sector, even the private sector, the levels can basically be the same. They still provide the largest. So if you take at the public sector, which should take the largest proportion of the work, and it actually does. The private sector does take, but because of restraints of financial ability, a large number of people still go to public. I'm not hearing much, and I'll see when this launch will come.
Yes.
And we have had interactions as a National Health Committee of the National Assembly with the Ministry of Health. But we haven't had enough interactions with the county governments. And I presume that the Senate should be having a more keen interaction.
Yeah.
Because it is those county governments that are going to provide the biggest number of services. It's this money, the pool. All this NHIF, SHA, it is a pool of money that we are collecting. The difference before NHIF was basically contributory. Now SHA has got 3 components, were contributory, and the one that comes, the 2 bits that come from tax. So we still have to get the whole system working together.
All right.
In my view, that, as even my observation from my position as a health committee member, I don't think it has really clinched in well.
And enrollment is a key criteria, so we'll be talking about that. So far, the number registered, and because now you are required to register for you to get a service, and only 1.9 million is what's on record, so you are talking about a population of 50 million plus. So we'll talk about that, and whether that can be achieved or attained when we get back from the break. Dr. Mundia and Dr. Nyekal here, as well as Dr. Pokose, who will be shortly with us here in studio. He's the chairperson of the National Assembly's Health Committee and the member representing Endebess constituency, as we expound on this very important subject matter concerning millions of Kenyans. Healthcare that's affordable is what they are seeking, and quality healthcare at that. The hashtag on X is Citizen Daybreak. The SMS code is 22422 at Citizen TV Kenya and at Ayub Abrikadin. More after the break here on the broadcast. Stay tuned.